Okay, although some people are still joining, I would like to take a moment to reintroduce myself. My name is Miriam Naiman, a senior advisor at Nefesh B'Nefesh. I am joined today by my co-worker in the background, Josh Sussman. If you've attended any of our webinars, you know Josh's name very well by now, and Dr. Tanya Kardash, Director of Maccabi Services in the Greater Jerusalem area. Although she's the Director of Maccabi Services, all four healthcare providers will be discussed, not by name, but rather how the healthcare system works in Israel. And the goal of today's seminar is to really leave you with a greater understanding of the basics of how healthcare is managed in Israel. Do keep in mind that Nefesh B'Nefesh will not be able to facilitate the return of those who are called a returning resident, a toshav chozer. We understand that there are people with different statuses when it comes to healthcare registration. Some of you might be considered an oleh chadash, somebody with no Israeli background. Some of you may be making aliyah as an ezrach oleh, a child born to an Israeli parent abroad. Some of you might be making aliyah as a k'tin chozer, a child who left Israel before the age of 14 and is now returning to Israel. And some of you might be a temporary resident of the past who had an A1 status in the past. We understand that registration for healthcare happens in different ways for different statuses. There are lots of other webinars that discuss this. Tanya will be discussing it in short, and if you ever have any questions, ask us at Nefesh B'Nefesh how your healthcare registration will be affected by your previous status. This is a wonderful webinar. It is chock full of information. We respect the fact that you all have questions. This is not the place for personal questions. This is the place for general information. Questions such as a specific medication or something very specific will not be answered here. I also encourage you again, as I mentioned earlier, that your questions that you have may be answered throughout the presentation. And as happens so often, people miss the answer to their question because it's already been spoken about while they're so busy typing in those questions. Before I give the floor to Tanya, if you just want to switch to the next slide. Tanya, you with me? The next slide just discusses.
I'm trying to move it. Hang on.
About Corona. People want to know about Corona in Israel. All Olim Chadashim are eligible for the Corona vaccine through their Kupat Cholim. There is no specific waiting period. Once you're done with your isolation period, you can make an appointment at your Kupat Cholim of your choice, your healthcare provider that you have chosen, and you'll be eligible for a vaccine. The Kupot Cholim offer free PCR testing within Israel, not for the purpose of travel, but to either get out of bidud, or if you suspect that you have corona or you've been subjected to someone with corona, you can get your PCR test at your healthcare fund at no cost whatsoever. Serology testing is available in Israel upon your arrival if you wish, but it is not covered by the Kupot Cholim. There are specific places that take care of serology testing. They are listed on the NBN website. NBN has a great website on how to shorten your bidud. It's an article on our website. Vaccinations are not mandatory by law, and for Olim Chadashim, one does not need to be vaccinated in order to make Aliyah. With that, once again, I encourage you to keep your questions to a minimum because I don't want you to miss what Dr. Kardash has to share. And Dr. Kardash, I give you the floor. Thank you so much for joining us.
Thank you. Thank you, Miriam. I will just add that with Corona, things are changing day by day. It's very important also for you to know that if you have been vaccinated already abroad with the Pfizer or with the Moderna vaccinations, we can log that into the system here. And with your serology results, you will be entitled to getting a green pass. As Miriam correctly stated, those people who haven't been vaccinated will be eligible to get vaccinations in Israel. And we've just heard that we've got a new delivery on the way. So within the next few days, we will actually be able to start giving more people vaccinations. Now, I want to talk a little bit about the healthcare system pre-corona times, and that's why I'm going back to giving you statistics from before corona, because a lot of the regular surveys and studies that are normally done annually, we haven't actually been doing in the past few years. Now, I want to tell you a little bit about how the Israeli healthcare system compares. In 2018, in the survey that was done, a very popular survey that's done of all the OECD and American countries, Israel's health system was actually ranked 4th in the world in the terms of efficiency. Now, efficiency looks at not just waiting times for appointments and costs, but also outcomes such as mortality and morbidity and life expectancy of individuals in that country. In 2017, the Bloomberg rankings, which is something I'm sure you're familiar with, they do a wide range of rankings for health, economy, trade, and Israel was actually ranked the 6th healthiest country in the world. Another thing which is important for you to know is Israel is really a country which is on the cutting edge of science and developments. It's a world leader in medical research. Over half of Israel's scientific publications in any given year are actually in the fields of medicine. We have a large industrial sector. Many of you have heard of Teva. Teva is actually the largest pharmaceutical company which makes generic medications. I'm sure many of the medications that you're all taking are actually made by Teva. And we're also, we use our ability, we're early adopters to develop the new pharmaceuticals and to bring them to the market quickly. You also may have heard that Israel is a leader in stem cell research. This is something which is very highly governed also by ethics, what it's correct to do, and not just by the science. So many people look to Israel as a country which has religious people standing at their head of the realm to manage the situation. Now, something that is important for you to know, and maybe do a bit of a switch from the Israeli healthcare system, from the American healthcare systems to the Israeli health system, is that all residents are covered. Anyone who is an Israeli citizen, an Israeli resident, has healthcare coverage. Now, another important point to note is there is a comprehensive basket of services. That means whichever of the 4 health funds you join, and I'll go into that in a few minutes, offer you the same services. Now, every year there's an annual committee which decides which new services and new medications are going to be included in the healthcare basket. Now, if the health funds, if this health committee makes a decision that something is going into the basket, then by law, all of the 4 health funds have to adopt this new medication or this new treatment. Now, this is something that's very reassuring for you, because it doesn't really make a huge difference which health fund you choose to join, because all of them will offer you the same treatment. Thereby, you don't need to start checking, does one health fund offer something that another one doesn't, because it's a standardized basket of services. Now, how is this health care system funded? It's funded in a couple of ways. First of all, there's a sum of money which is put aside by the government every year. And on top of that, every working citizen or every citizen over the age of 18 who's resident in Israel pays a health tax. It's part of the national insurance contribution, which if you're a salaried worker is deducted at source. And this money goes to the government, and together it's divided out to the health funds according to what percentage of the population each health fund covers. Now, on making Aliyah, as an Oleh Hadash, who isn't yet earning money, you have 12 months free membership. If someone starts a job earlier than that, they will start paying a health tax before that time. Now, it's also important to know, if I'm comparing the situation of the health coverage we have here to maybe the private insurances you may know, because it's a non-profit organization and because everyone is covered, there's no age limitation. There's no health limitation. Someone can make Aliyah in the middle of having treatments for a cancer diagnosis and be eligible automatically to pick up the treatment. There's no exclusion for pre-existing illnesses. And again, there is no waiting period as long as you're an Oleh Hadash. If you are, as Miriam previously stated, a returning citizen, then things might be different. So this is very important to consult with the necessary bodies to actually find out what your status is. Now, I mentioned to you a few minutes ago, there's 4 different health funds. There's Maccabi, Mu'chedet, Clalit, and Leumit. How do you choose which one to join? Now, as I would advise Olim in general, in many fields of the Aliyah, first of all, it's worth speaking to people who are already living in the area to ask them which health funds they're with and who they're happy with. As I mentioned to you on a slide previously, there really isn't a huge difference in the services provided by the health funds. So the differences really lay in three things. First of all, which health fund is strong in the area where you're living? Not all of the health funds are strong countrywide. For example, if you're in the Jerusalem area, you've really got Maccabi, Mu'chedet, and Leumit. If maybe you're living in a kibbutz in the north, the strongest health fund might be Clalit. And if you're living in Renana or in Modi'in, it's probably Maccabi or Clalit you're looking at. So one of the things is the area, the geography, where you're actually living. The other point to mention is who are the doctors in that area who are going to be giving you healthcare? Are there English-speaking doctors that you can choose to join? That's very important. It's very important to speak to a doctor in your mother tongue. It's not really a time to try out your Hebrew. It's really a very stressful time when you're making Aliyah, and it's very important that also the doctor knows what you're going through and also can understand you on a level below the surface of just what you're saying, but can actually read between the lines and see what's going on with you. And the third factor is which hospitals your health fund works within that area. It might be that you have a specific condition that you've chosen a hospital that you would like to be treated at. It's very important to find out if your health fund has an agreement with that particular hospital. Now, let's say you joined one health fund and after you realize you should actually have been in another one. It's not a problem to change over. You're allowed to, as an Oleh, twice a year change. We don't encourage the whole time hop from one health fund to another, because it is important to establish a relationship and continuity of care with one healthcare provider and with a medical team. Or, for example, you just made the wrong choice, you do have the ability to move over to another health fund. Now, I'm going to try here and do a little bit of, to put things a bit straight, because this is a question that I frequently get asked. What I've been talking to you until now, what I've been talking to you about is the basic healthcare fund. That is what every resident in Israel is entitled to by law. And that is what you get by paying your national insurance contribution, which contributes to the health tax. Now, on top of this, there are 2 further levels, which I'm going to be talking about in the following slides. The first level is the supplemental insurance, and the next one is the private insurance. So try and remember this pyramid as I'm going forward. Now I'm going back a minute now to the health basket that I was talking about, which is the floor of the pyramid, the first layer. What does the health basket include? This is the basic insurance package. It includes your doctor's visits, blood tests and imaging studies, if you needed to be admitted to hospital and surgeries, paramedical treatments such as physiotherapy, speech therapy, occupational therapy. Dental care is included for those until the age of 18 or those over the age of 75, and also mental health care. Which services aren't included in the healthcare basket, and we'll come back to them in a minute and we'll speak about them again. One is dentistry for the age of 18 plus. It is subsidized in the supplemental care. Optometry. By optometry, I'm talking about contact lenses and glasses. I'm not talking about going to see an eye doctor for a regular follow-up or to check if you've got glaucoma or cataracts or any other eye problem. And chronic nursing care, which we will also speak about as we go on. Now in Israel, your primary care doctor, he is your case manager. He's your family doctor, your general physician, or in the case of children, he's your pediatrician. Now, he is generally the person you'll go to with almost any complaint you have, and he or she will send you to do the necessary tests and then refer you on to a specialist if needed, or even sometimes he will consult with a specialist for you without the need for you to actually go and sit physically with them. Now, in Israel, there are some specialties where you can turn to directly without going through your primary care doctor. And these are orthopedics, obs and gynae, ophthalmology, dermatology, and ENT. But I do recommend here, and because of that, I've put orthopedics and ENT slightly set inside. I do recommend that you speak to your primary care doctor first. I'll give you an example. Say, for example, you've got a problem with your knee. If you go and see your primary care doctor, he will examine you and he may very well send you to do an ultrasound or even an MRI scan before you actually go and see the knee specialist. So by the time you go and see the knee specialist, you'll actually have the full workup needed for the knee specialist to make his diagnosis. Another reason is that over the years in Israel, and not just in Israel, worldwide, certain specialties have really gone into subspecialization. So if maybe 20 years ago an orthopod would treat any complaint in the bones in the body or anything to do with the skeletal system, nowadays we tend to have orthopods which specialize in knees, others in backs, others in arms and shoulders. So really your family doctor will be able to direct you to the most appropriate person to give you advice in your situation. Now, the secondary care specialists that I've mentioned to you before, and not just those that I said they're direct access, but all the other specialists, if we're talking about endocrinologists, hematologists, nephrologists, the referral again is by your primary care physician. Now, in Israel, there's really two main ways to see them. First of all, there's the specialists which sit in the community. Now, these people are all specialists and they are generally doctors who work in the hospital during the day. And very often in the afternoons, when they finish their hospital obligations, they'll come and they'll sit in the community clinics and you can make appointments to see them there and they can then offer their advice and consultation on how you should proceed forward to manage your medical condition. Now, there is also an option where you can make an appointment with an outpatient clinic. This generally is a less preferred option other than for certain specialties which are really hospital-based, such as oncology, such as plastic surgery. The reason for this being is if you go to a hospital outpatient clinic, you're not necessarily guaranteed to see the specialist, the consultant. You might actually be seeing one of the more junior doctors who happens to be working in the clinic that day. Whereas if you go and see the specialist who is in your healthcare provider's clinic, that will only be an actual specialist, an actual consultant who is fully specialized in that field. Now, if for any reason you do need to go and see a hospital, as I mentioned to you before, each health fund generally has agreements with certain hospitals that they prefer you to go to. And if you do go there, you will need to bring with what's called a Tofes 17 or a Hitchayvut, meaning a Form 17 or an obligation. That is basically the equivalent of a blank check where your health fund is saying, I'm honoring and I will cover any financial cost that is run up while you're in the hospital. The system works in Israel with the health funds whereby we give you the obligation ahead of time rather than you laying out the money and then coming back to claim it from the health funds. So before you go to the hospital, other than of course in an emergency situation, you sort out the paperwork with the health funds and then you don't need to outlay any money. Now, how do you make an appointment for a doctor? It's changed massively over the past 20 years. When I made Aliyah 20 years ago, it was generally with a clinic receptionist. But now, most of the people are making an appointment on the application. You can go online and do it. There's a 24-hour call center with all of the health funds, and they have people there who are speaking English. Or, of course, you can do it the traditional route. You can call up the clinic receptionist, or you can pop in, or as many of my patients do in my clinic, they send me a WhatsApp and they expect me to make the appointment for them. Now, also the internet has become a site and a source of information for all who need healthcare. You can even today, you can go in, you don't need to be members, you can look on the health funds websites. You'll see that many of the health funds actually have English capabilities there and English translations, and you can find information on your rights and on your benefits. You can also find, once you're a member of the health funds, you have a personal portal where you can go in and you can see what is your personal healthcare record and what reminders you have. You could be reminded there to, it's time to do your mammogram, it's time to do blood tests, you need to maybe go and have your blood pressure checked with your doctor. And it's also a way of communicating with your doctor. You can send online a request to have a prescription renewal sent straight to the pharmacy, maybe a sick note, or maybe a referral if you don't actually need to see the doctor. The websites also allow you to take out travel insurance and even order your medication and have it delivered from the pharmacy. Now again, the applications, once you're a member, then they give you many things other than just a way of following up what you're doing. It really is your personal medical record. It means if I go abroad, I can open up in English all of my medications, my hospital admissions, my blood test results, and I can show it to any other doctor anywhere in the world. For those who are pregnant, there's a very nice application allowing you to track your pregnancy. And also for those doctors, if there's any of you who are doctors out there, something which I personally find very useful as a family doctor, I have a way there via my phone, my mobile phone, to actually check in and see my patient's blood results, to see my patient's x-ray. For example, if I sent someone to do an urgent x-ray, I can actually look while I'm at home on the result, and I can even get in touch with them from my phone, and I can tell them how to carry on their management. Now, what does one do out of hours? Generally in Israel, you'll find that doctors work quite long hours. We generally start 7 or 8 in the morning and carry on till about 7 or 8 o'clock at night. But as we all know, accidents sometimes happen in the evening or a few hours before Shabbat, and there's no one in your clinic who can help. So there are a number of ways you can get help. First of all, there is always the option of calling directly to Magen David Adom, or the national, it's the Red Cross equivalent, or National Ambulance Service, which is 101. So if someone is collapsed in front of you, and God forbid you think they've had a heart attack, a stroke, or they've lost consciousness, first of all, you call 101. But let's say the situation isn't quite so dire. Let's say it's a child who's fallen out of a bunk bed and you're worried maybe they've broken their arm and what you should do. In this situation, you can call up the 24-hour helplines, which are staffed by which all of the health funds have, and they're staffed by nurses with doctors backing them up. And you can ask where you should take your child or where you should take the person who you're accompanying. They might very well be able to tell you that there's an urgent care clinic, such as Terem, very nearby, and that would be the appropriate place to take your child instead of the emergency room. There might be another situation where they say, well, sit tight, we'll send someone to the house to check you first, and then we'll see what needs to be done. It's always best to consult with them, because as there are in many countries, if someone goes to the emergency room and it's considered an inappropriate referral, you may have to join in with some of the cost that was incurred by that unnecessary hospital visit. Now, there are situations where someone can no longer come to the doctor's clinic. Now, I'm not talking about a situation that someone doesn't have a car and it's less easy for them to get there. I'm talking about a situation that because of a medical situation, someone is unable to come to the clinic and to have their medical services from the doctor, nurse, and medical team who are there. This situation could be something which is a temporary situation or something which is a more chronic situation. I'll give you some examples. The temporary situation could be that someone's had a hip replacement, and for the initial period of time after the hip replacement, they need to have the physiotherapist and they need to have the nurse to check them, come to their house to do so. But the ultimate aim of having the hip replacement is that someone's going to have increased down the line. They'll be able to mobilize and go and get their services, their physiotherapy and their nursing services from their local healthcare clinic. There could be another situation whereby maybe someone's wheelchair bound or someone's got Alzheimer's and it's just very difficult for them to get out of the house. If that is the situation, then what will happen is you will be allocated a personal team who will treat you. So you will have a regular doctor and a nurse and whatever other disciplines you need who will come and will visit you at home. Now there is, as many of you may have heard, we have in Israel what's called Tipakhalav, literally meaning a drop of milk. And that's basically the mother and baby clinic. It's something which is very well established in Israel, that the care for the well-born baby is actually separated from the pediatrician's clinic, whereby the sick child goes. So these are generally separate clinics to make sure that there's no mixing between the sick kids and the well kids, whereby the mother goes with her newborn infant or even during pregnancy, and the child is screened for any developmental delays. Immunizations are given. There's breastfeeding consultants there. And also there's education which is given to new parents, such as safety, using car seats, safety in the home, preventing drowning. And this is something which is done very, very well in Israel. And it allows us to pick up on developmental delays at a very early stage, and thereby enables us to start intervening quite early on. Now, until now, everything I've said has been that bottom layer of the pyramid that I spoke to you about a few slides ago. We're now jumping up to the middle layer, which is the supplemental health insurance. Now, the supplemental health insurance is optional, but around 88% of the Israeli population actually take out the optional insurance. Again, here, there is no exclusion criteria, so you can join it whatever your healthcare status is before you've made Aliyah. And you can generally choose between 2 or 3 tiers, depending on the health funds. Now, you have to join the supplemental health insurance of the health fund that you've joined. Generally, the benefits vary very slightly between the health funds. And something which is important to consider is that you get immediate coverage if you join within 90 days of making Aliyah. Now, if you don't join straight away, there may be some waiting periods incurred on some of the services that are offered. Now, to give you some examples of what type of services are offered, there are medications which aren't necessarily included in the health basket, which are offered at a 50% cost. You can go and have a second opinion with a whole list of specialists who are generally heads of departments or senior doctors in hospitals, and you can do that 3 or 4 times a year, with Makar being covering 80% of the cost, or whichever other health fund you're with. You can choose if you need a surgery to have that operation at a private hospital, or sometimes to take a surgeon privately. You can get discounts on complemental healthcare treatments, such as reflexology, Chinese herbal medicine, chiropractic, acupuncture, and many of those disciplines. And if you remember, I mentioned to you previously that children over the age of 18 and people under the age of 75 don't have their dental health care regularly covered in the health basket. So here there is an option for discounted treatments in the clinics, in the dental clinics affiliated to the healthcare funds during the age groups where you're not entitled to free care. Now, something I will say to you, if you decide to move from one health fund to another health fund, you are allowed to join the supplemental insurance on the same bracket that you were previously in your old health funds without losing your rights, without being incurred a waiting period. So that's something that's very important to know. Now, I'm going to mention this very briefly, and maybe Miriam will add something if she feels there's something to add. I'm very often asked about disability benefits. Now, that is something which is not through the health funds as such. It is through the national insurance, or Bituach Leumi. Now, who is entitled to disability benefits? It's people who are basically in the working age, in the working age group. So it's those people aged 18 upwards until retirement. And it is those people that, because of a medical condition or a mental or physical condition, they are unable to work, so they don't have earning capacity. And someone can get a minimal a disability allowance, or they can get a maximum, which is 100%. So where do the doctors here play a role? The doctors play a role in giving you medical documentation and medical reports that you can take to the disability committee that basically make the decision if you're entitled or not to a stipend, to money being given to you. But I don't know if Miriam afterwards wants to add anything on, but this is not something which is given to you by the health funds.
The only thing that I would add, Dr. Kardash, is that there are many disabilities that are clearly a disability. There are other disabilities that may be viewed as a disability in one's country of origin, but might not be recognized as a disability here in Israel. And that is why everyone who's applying for disability will be re-evaluated regardless of any statement that they've been given from their country abroad.
Okay. Now I'm going to continue with another issue here, which again, Miriam in her expertise might be able to add to. Nursing care. When someone becomes what's called a nursing care patient, which is someone who is over the age of retirement age, and they are suffering from a medical condition that requires assistance in performing the basic activities of daily living, which is washing oneself, which is dressing oneself, which is feeding oneself, which is toileting oneself, and which is transferring from bed to chair. If someone is given to them by the doctors and the health funds, or a stipend or a benefit or a going into a nursing home, is again not via the health funds, it's via the welfare, via. Okay. So I'm not going to go into too much about what actually one gets with nursing care. I believe if people have specific questions, it's better to address them as it were with your Aliyah advisor. Now I am going to talk, before I get to what to bring with you when you make Aliyah, I am going to mention a few words about the third level of the pyramid, or about the private healthcare cover. Now, some people choose to take out, on top of the basic and supplemental in the health funds, private insurance policies. Now, why do people choose to take these out? People choose to take these out sometimes because you may be able to get coverage for disastrous situations, I call them, such as if someone needs to have a transplant and doesn't want to wait their turn on the transplant list in Israel. There are policies that would allow you to go abroad and get a transplant there. There are also other situations where people may want to choose to have a surgery abroad because, let's say, their family members are still there, which the Israel health basket wouldn't cover for you if the operation was able to be done in Israel. So generally, these are really disaster insurances that people take out, and there's something which you need to speak to an insurance broker, whether it is something correct for you to do so, and what the financial cost is. But that's not something brokered through the health funds. And you have to remember that there are exclusion criteria for these private health funds. And very often, over a certain age, one can't join them. Now I'm going to come to some more practical tips here. What does one bring with when they make Aliyah? It's very important that you bring a medical summary. I'm not saying to bring an entire hundreds of pages of medical notes. A summary is very important. Again, it's very important to bring with your vaccination records, especially if you've had a corona vaccination. Please come with at least 1 month's supply of medications. You will be able to get and see a doctor quickly, but you don't want to, the minute you've got off the plane, to have to find a doctor to run to renew your medications. If we're talking about medications, if you're on any special medications or very expensive medications, please make sure you've checked it out before you've made Aliyah with Nefesh B'Nefesh or with myself or one of the healthcare advisors to check that your medication is available in Israel and to check how long it will take for us to set it up. Please also bring with you discs and reports of previous imaging studies. Very often a previous mammogram can act as a baseline for future tests to compare any abnormal findings. And do bring with you, if you've had any hospital surgeries or admissions recently, it's important to bring those notes with you as well. I think really there I've summed up the main points. I think if I tell you any more, you won't remember anything. Miriam, do you have anything to add, or are there any questions we need to answer?
I'll tell you, only because there were a couple of questions on one specific point, and that is when there is a chronic care need. Somebody with diabetes, or somebody who is on dialysis, or somebody who has a chronic care need, any benefits through their healthcare provider with chronic care.
So if someone has diabetes, as I said, most of the medications are available in Israel. That won't be a problem. If someone is coming and a dialysis patient, they do need to be in touch with someone ahead of time, because you do need to make sure you've generally got a 2-3 day window between having one dialysis treatment and setting up the next. So that's something that's very important to liaise before you're coming. Again, if a patient's in the middle of chemotherapy treatments, it's very important that there's a seamless handover of medical care from one team to the other. And Nefesh B'Nefesh will help facilitate that with one of the health funds for you. Now, Miriam, I don't know if you want to say a few words about the transfer of someone who's in need of chronic nursing care and how that's done, because I think that's also an important aspect to be addressed.
That is an important aspect, and it is something that we discuss when we have events such as these, when we talk about bringing an elderly parent or somebody who's going to have a particular need with, for a carer, for a caregiver, or to be put into a nursing home. I don't want to take up your time here. Just a couple of questions, simply because we have a few moments. I do want to remind everybody that on July the 19th at 1 p.m. Eastern Standard US time, that will be 8 p.m. Israel time, that there will be an open forum, Q&A forum on healthcare. So if you want to make a note of that. Dr. Kardash, the question is fertility coverage covered on the basic level of care?
On the basic level of care, a new Oleh is entitled to 2 live-born children, okay? So you can have, as long as a doctor has decided that someone is medically fit to have fertility treatment and that the treatment is still viable, meaning that they still have viable eggs in their ovaries, then they're entitled to fertility treatments until they have 2 live-born children. Now, over a certain age, or if someone doesn't have viable eggs, they will also be eligible for funding for egg donation and fertility treatments. Now, let's say someone has 2 live-born children already and they are interested in carrying on expanding their families. If they have the supplemental insurances, they will be able to carry on again, as long as the obstetrician and gynecologist has said they are medically fit and their bodies are sound to carry a pregnancy, then you can carry on having further children if you have the supplemental health fund coverage, and there is the cost is covered.
Excellent. Thank you so very much, Dr. Kardash, as always, for your time. Dr. Kardash's email is here. I always invite people to notice that there is an underscore between the H and the T. That is why there's a space. So it's Kardash_T@mac.org.il. And I want to thank everyone for joining us this evening. I'm going to try to answer these last few questions. If I didn't get to your question, that's okay. You can write to myself. You can write to your Aliyah advisor if you already have one, or you can attend the open forum on July 19th at 1 p.m. Thank you, everyone, and have a great day.